Hello, dear viewers. Good day to you. Welcome to another episode of Afya Health and Lifestyle Interview Series. On this episode, we have with us a guest that has been here before. And when she was here, we talked about liver diseases and liver cirrhosis. That is the diseases of the liver and things that can cause them. And if you remember clearly, at the last episode, we said that there are lots of things that can cause infection in the liver. So today we are going to be looking at another one of such. So we are bringing back our guest, Dr. Alao, to talk to us about hepatitis B. I'll be bringing out now.
Dr. Hawwa Alao is a dual-trained gastroenterologist and hepatologist. She specialized in clinical and RNA-based translational research focused on viral hepatitis, liver fibrosis, and cancer. She is a fierce advocate for research and improvement of liver disease globally, particularly in Africa. She is currently an assistant professor at the UND, where she teaches second and third year medical students. She is the director of hepatology and outpatient gastroenterology at True Health. Our goal is to help patients understand their disease burden so they can make better decisions about their health. In her free time, she likes to hike, read about African history, and does not miss a beat with the African music genre.
Good day to you, Dr. Alao. Welcome to this episode of Afya Health and Lifestyle Interview Series. If you don't mind saying hi to our dear viewers.
Hi, everyone. Thank you for having me. I'm very excited to be here and to talk about one of my favorite topics.
Thank you very much for joining us. Without wasting time, like I do say, because we need to go straight into why we are here, we want to talk about hepatitis B. The last time we talked about liver diseases and things that can cause them. We talked about alcohol causing liver cirrhosis and how that can lead to very, very bad liver conditions. Today, we want to look at hepatitis B. What exactly is hepatitis B?
Thank you for asking that question. So, hepatitis B is a serious liver infection that causes inflammation and can lead to liver damage and is caused by a hepatitis B virus. It can be acute and it can be chronic. So, acute hepatitis B lasts less than 6 months. Your immune system is likely to clear the infection from your body, and you can recover within a few months. Most people who get hepatitis B as adults have an acute infection, but it can lead to chronic infection. And chronic hepatitis B lasts for more than 6 months, and it lingers because your immune system cannot fight off the infection. So chronic hepatitis B may last a lifetime, possibly leading to serious illnesses such as cirrhosis and liver cancer, like we've talked about before. The younger you are when you get hepatitis B, particularly newborns or children younger than 5, the higher your risk of becoming chronic infection. Okay, and it can go undetected for many decades until the person becomes seriously ill.
All right, thank you very much. You said the younger you are when you get infected, the higher the chance of it being chronic. And when you're an adult, it is most likely going to be acute, and that will take less than 6 months before your immune system clears it. Looking at the range of people that can have this infection, what exactly can we say is the cause? Like, how do one get infected by hepatitis B?
Correct. So, hepatitis B is spread when blood, semen, or other body fluids infected with the virus enters the body of someone who is not infected or has not been vaccinated from the virus. So you can become infected from birth, from mother to baby, sex with a partner who has hepatitis B, sharing needles, syringes, or drug preparation equipments with each other, sharing items such as toothbrushes, razors, medical equipment such as a glucometer, with a person who has hepatitis B, direct contact with blood or open sores of a person who has hepatitis B, and then exposure to blood from a person who has hepatitis B through needle sticks or sharp objects, which can happen to people who are in the medical field.
All right. Okay, that is very clear. Looking at what you've said and how you can get it, it looks very, very similar to the likes of HIV, and so our viewers don't confuse it. Can you shed more light on this, on how it works?
So viruses are very similar in terms of how you can get them. So you're right, it's similar to HIV in that sense, but some viruses are more infectious than others. So out of hepatitis B, HIV, and hepatitis C, hepatitis B is actually the most infectious out of all three viruses, but you certainly can get them the same way. So I
Yes.
think the next question is, how common is it in Nigeria? Because, that's our audience. And I think it's important to answer that question as well. So Nigeria is endemic for hepatitis B, with over about 70% of the population showing evidence of either past infection or with the virus, and about 24% of the population showing serological evidence, meaning blood evidence of current infection. About 17 million Nigerians are currently infected with hepatitis B, and about 5.6 million of those people may die from the consequences of this infection. So it's something that we certainly need to get under control and we need to be aware of.
Looking at these statistics, it is scary because the numbers are very, very high. What do people need to know? You've
Yes.
told us how it can get infected, but how can we prevent this? What do people need to know? What do they need to do? Because with this number, it's looking like we're going to be even having more if a lot of things is not put in place to curb this infection.
So before I go into prevention and what we need to know, I think it's important to know the symptoms as well. So let's talk about the symptoms of hepatitis B. Some people who are infected never feel sick. Others who are newly infected will have symptoms that can last for several weeks. The issue is that most of the viruses, their symptoms are very similar. And unfortunately, they're very similar to malaria symptoms as well, except for a few differences that we will talk about. So you can get achy muscles or joint, stomach pain, loss of appetite, mild fever, loose stool, diarrhea, lack of energy. You can have yellow skin or eyes, which we call jaundice. And then you can be sick to your stomach. Your urine can turn brown, almost as brown as Coca-Cola. And then more than 90% of people who get it as an adult, like I said, will recover from their symptoms. The other thing that we need to know is, how can we diagnose it? The important thing is a blood test. Okay, hepatitis B is not routinely checked by your primary care physician in your annual physical exam, which it should be, given that Nigeria is an endemic for the infection. I think it's something that should be routine for every single person to get checked. So blood test is one that can be done. Abdominal ultrasound to look at your liver and make sure that it's nice and healthy, and make sure that there are no complications already from cirrhosis or damage from the liver. And then the liver biopsy is the ultimate diagnosis, meaning taking just a little piece of your liver and looking under the microscope to see what type of damage has already been done by the virus. That last step is usually not necessary once you've done your ultrasound and the blood test. So, how is hepatitis B treated? People who start hepatitis B treatment may need to take medication indefinitely because there is no cure for for hepatitis B. You can be vaccinated against hepatitis B when you're at a young age, or even as an adult if you've never had it before. But once you have it, unfortunately, there is no cure. But you can get a medication that you take only once a day that will keep the virus at bay and keep you undetectable for the rest of your life. That is definitely possible. And so I think the other question that we should answer is, who should be vaccinated? Since it's something that is very preventative, but unfortunately, it seems like we don't have a standard plan or in place in terms of vaccination. So hepatitis B vaccination is recommended for all infants, children, because we talked about the risk of mother to baby in terms of delivery. So if you're pregnant and you have hepatitis B, one of the things that is done is that you are going to have a C-section instead of a vaginal delivery to decrease the possibility of you transferring the infection to your baby will also get some injections and vaccination immediately after birth. Those are the kind of things that can be done. So children, infants, adults through the age of 59, regardless of if you're traveling to an area that's endemic for hepatitis B. For adults who are 60 years and older, hepatitis B vaccination is recommended for people who are visiting countries where hepatitis B is common, and Nigeria is clearly one of those. The vaccine is very, very safe. And the only thing that you get is soreness in the injection site, which is the most common side effect. Okay. And I think the other thing that we should discuss is what people with chronic hepatitis B can do to take care of their liver if you have the infection. So people with chronic hepatitis B should be under a care of a healthcare provider, a doctor who is knowledgeable and trained in the illness. So a gastroenterologist or hepatologist, a liver specialist, to regularly monitor your liver function. Okay, and people recently diagnosed with hepatitis B should definitely get vaccinated against hepatitis A, and they should be tested for hepatitis C and other viruses as well to make sure they don't have co-infections. Avoid drinking alcohol because alcohol is only metabolized in your liver, so you don't want to cause more damage from a liver that's
Yeah.
already sick from a virus. All right, and you want to follow a healthy diet as well and just stay very physically active. Obesity and fatty liver disease is another problem that we can talk about later that can cause liver problems. And then check with your doctor before taking any prescription pills or nutritional or herbal supplements that may harm the liver, especially the over-the-counter ones. Those are the things that you want to do. And if you need to be treated for hepatitis B, certainly there are very great medications that you just take once a day and can keep you from getting any of the complications from hepatitis B.
All right. Thank you very much. That is quite extensive, and we've talked about a whole lot of things. You've told us about the symptoms. You've told us about things we should do to keep ourselves safe. And yes, we've talked from the angle of Nigerian citizens, what they can do to ensure that their liver is in good health, and then um, checking one's health with a practitioner, professional, to ensure that one is safe, and proper use of drugs. Looking at the numbers, there is no doubt that government intervention is needed because citizens cannot just do it alone. So what is it that the government are doing currently to ensure that this is nipped in the bud? Is there anything you know that the government is doing currently? What do you think should be done to ensure that these numbers go down drastically?
Yeah. So I will be honest, I'm not sure that I know of any program that the government per se is doing. I know that the WHO and CDC try to get databases and numbers in terms of people who are infected with hepatitis B so they can get an accurate count of how many people. The problem with us, unfortunately, is that we don't have a database to know the amount of people who are infected and which areas do we need to concentrate on. I think those are the important questions that need to be answered. The other thing, again, this is a very preventable disease. Just with vaccination and starting with young children, especially newborns, you can prevent this from happening and from increasing our statistics in hepatitis B. So vaccination is extremely important. Getting tested is extremely important. So even if the government is not clearly doing much about it, I think we as individuals should take our health in our own hands and making sure that we see a doctor that can clear and make sure that we don't have this infection. And if we do, making sure that we're getting the right medication that can keep us healthy and safe.
All right, thank you very much, Ma. Awareness concerning hepatitis B. Is there any particular day in the year that is set aside for awareness so that the more people know about it, the more they try to ensure that they are safe from it? So, concerning awareness, is there any day that is set aside for
Um,
hepatitis B?
I think there is a World Hepatitis B Day. Actually, there's an awareness month as well, I believe, if I'm not mistaken. May 19 is World Hepatitis Day, period. It's the month of May also is the hepatitis month. So May is the day in the United States, though. So every country might be different. And clearly, I am in the US, so I know that May is the month that we try to bring awareness and we do a lot of activities here, May 19 to be precise. But I'm not sure if we have that in Nigeria. But that's one of the things that I think that we should start talking about and developing. Correct.
All right. Thank you, Ma. So before we go, during the course of the interview, you mentioned hepatitis C and the likes. What makes hepatitis B unique? And looking at the fact that there are so many other hepatitis that can affect the liver, I guess in subsequent interviews, we'll bring you back to talk to us about those. But what makes hepatitis B unique?
So hepatitis B is I'm going to be a little nerdy here, but it's a very beautiful virus. So it's a DNA virus, and it has an intermediate RNA replication cycle. The only place that it replicates in is in your liver cell. This is why it affects just the liver. Why it's unique is that in all of the other viruses, hepatitis B is one that actually incorporates itself in your DNA, unfortunately. We call it CCC, closed circular DNA. Okay, so this is why, unfortunately, it's extremely hard to get rid of it, and most of the infection is for life. There is no cure, because even if we get you with the medication, we can keep you undetected, but there are times when you stop the medication, if you do, the virus can certainly come back. Okay, so unfortunately, what we've noticed is that it incorporates itself in your DNA, and that is how it's able to keep itself from being cured, and it can replicate itself when it needs to.
All right. Thank you very much, ma'am. So, concerning the vaccines now, are the vaccines free? And where are the places where these vaccines can be collected so that Nigerians can know exactly where to go to get hepatitis B vaccines?
So I am unclear if hepatitis B vaccination is free, but I know that it's cheap. So places that you can go are primary care physician should be able to give you hepatitis B, at least here in the United States. Any clinic, any office have ample supplements. I'm sorry, ample supply for the vaccinations for hepatitis B, hepatitis A. In Nigeria, to be honest with you, I'm not sure if there is an actual program for vaccinating people. I know the CDC and WHO have certain days and awareness that they do, that they may go to a certain area and just vaccinate people. I think the other problem is, again, awareness and not being scared or afraid that someone, I think one of our problems in our culture is we have this fear that, you see someone who's trying to give you a vaccine, it might be an experiment or research, things like that. That's one of the things that I think that we need to work on and try to dispel and just give more information for people so they can make the best decision for themselves. But in terms of the vaccine, any primary care or big hospital like UCH in Ibadan, Luth in Lagos, LASUTH will definitely have ample supply of hepatitis B vaccination. And if you request it, they can certainly give you that. But any gastroenterology clinic as well should definitely have ample supply of hepatitis B vaccines.
Thank you very much, Dr. Alao. This has been very, very enlightening, and I am sure our viewers are grateful for this new information and would definitely act on it so that we can generally have healthier lives. Thank you very much for joining us today. We look forward to seeing you some other time.
Absolutely. Thank you.
All right, that was Dr. Awa Alao, and we are really grateful that she joined us. I'm pretty sure we've learned a whole lot concerning hepatitis B and its effect on the liver. Of course, it looks like malaria. The symptoms are probably making you feel like it is malaria, but it is not. So the best thing you need to do is go check yourself, get vaccinated. Get vaccinated, because that is the only way you can keep yourself safe. When you have it, there is no cure for it, but there are drugs to keep it down to the barest minimum so that you can live a generally healthy life. So thank you very much for joining us on this episode. We look forward to your comments, subscription on our social media platforms from Instagram and YouTube and Twitter. Thank you once again and have a nice day.